If you're over 60 and you think walking is the best exercise you can do, stay with me for the next few minutes, because what I'm about to share might completely change how you move for the rest of your life. Surgeons are now recommending one simple chair-based exercise that activates more muscles than walking, improves circulation faster, protects your joints, and can even reduce fall risk. All without standing up. And the shocking part, money. Money. Seniors who walk every day are still losing strength, while those doing this one exercise are getting stronger. Most people believe that walking is the gold standard for senior health. And yes, walking is good. It helps the heart, clears the mind, and keeps you moving. But here's the truth. Doctors don't often say out loud, walking alone is not enough after 60. As we age, the body doesn't just need movement. It needs muscle activation, joint stability, and nerve-to-muscle communication. Walking mainly uses a limited range of muscles, and over time it can actually worsen knee pain, hip stiffness, and lower back problems, especially if posture or balance isn't perfect. Surgeons see this every day. Patients come in saying, "Doctor, I walk every morning, but I still feel weak, unstable, or tired." And that's when many orthopedic and vascular surgeons now recommend a specific seated movement that safely activates the legs, core, and circulation all at once. No treadmill, no pressure on the knees, no fear of falling. Let's talk about what really happens to the body after 60, because this is where everything starts to make sense. After the age of 60, muscle loss accelerates. This process, known medically as sarcopenia, causes the legs to weaken first. Weak legs mean slower walking, poor balance, and higher fall risk. At the same time, blood circulation to the lower body decreases, which leads to cold feet, numbness, swelling, and fatigue. Joints also lose lubrication, making every step feel heavier than it used to. Now here's the problem with walking. Walking does not fully engage the thigh muscles, especially the quadriceps and hamstrings. In a controlled way, it also does actively strengthen the muscles responsible for standing up, sitting down, and stabilizing the knees, the exact movements that determine whether someone stays independent or needs assistance. This is why many seniors who walk daily still struggle to get up from a chair or climb stairs. Surgeons focus on function, not just movement. They ask a simple question: can this person safely sit down, stand up, and control their legs without pain or wobbling? And the exercise I'm about to share directly trains that ability. This is why surgeons increasingly approve a simple, chair-based leg press movement, often called a seated sit-to-stand progression, as one of the most effective exercises for seniors. But don't worry, this is not a gym exercise. You don't need to stand fully if you're not ready. You don't need weights. You don't need special equipment. Just a sturdy chair in your own body. Jesk exercise can I perform walking. First, it activates multiple muscle groups at the same time. Thighs, glutes, calves, core, and even the lower back stabilizers. Walking mainly moves the legs forward and back. This exercise pushes against gravity, which is what keeps muscles strong. Second, it improves circulation more efficiently. When muscles contract and release rhythmically, they act like a pump, pushing blood back toward the heart. This reduces leg swelling and improves oxygen delivery to tissue. Third, it trains balance and coordination in a controlled, safe environment. You're close to the chair, supported and stable. Many surgeons recommend this exercise after knee surgery, hip surgery, and even heart procedures, because it builds strength without stressing the joints. If it's safe enough for post-surgery patients, it's safe enough for most seniors when done correctly. Now let me explain exactly what this exercise is in simple terms. You sit on a chair with your feet flat on the floor, shoulder-width apart. Your hands can rest on the armrests or on your thighs. From this seated position, you gently press your feet into the floor and lift your body just a few inches off the chair, not fully standing. Then slowly lower yourself back down. That's it. One controlled movement up, one controlled movement down. That this slow, controlled motion is what makes it so powerful. Muscles respond best to controlled resistance, not fast movement. When you push up slowly, the thigh muscles fire deeply. When you lower yourself slowly, those same muscles work even harder to control the descent. Walking doesn't provide this kind of resistance. Even doing this movement 5 to 10 times can create more muscle activation than a 20-minute walk. And because you're seated and supported, there's far less risk of falling or joint strain. But the real magic happens when this exercise is done consistently. Surgeons report that seniors who practice this daily often notice improvements within 2 to 3 weeks. Standing up feels easier. Knees feel more stable. Legs feel stronger. Even walking itself becomes smoother and more confident. There's also an important brain connection here. This exercise improves what doctors call neuromuscular coordination, the communication between your brain and your muscles. Each controlled movement reinforces nerve pathways that weaken with age. Better communication means faster reactions, better balance, and fewer missteps. And here's something surprising. This chair exercise can actually make walking safer. Many falls don't happen because people are walking. They happen when starting to walk, stopping, turning, or sitting down. This exercise directly trains those transitions. If you've ever felt nervous about losing balance, if your knees ache after walks, or if you feel tired even though you try to stay active, this is exactly the kind of movement your body has been asking for. In the next part, I'll explain how to modify this exercise for beginners, how many repetitions surgeons actually recommend, and the biggest mistakes seniors make that reduce its benefits. Now let's talk about how to do this exercise the right way for your body, because this is where most of the benefits come from. Surgeons are very clear about one thing. This is not about speed, and it's not about pushing through pain. The goal is controlled strength and safe activation. If you're just starting, the best version is the partial lift. Sit toward the front half of the chair so your feet are firmly planted on the floor. Your knees should be roughly over your ankles, not far forward. Keep your chest upright and your eyes looking straight ahead. Now press your feet gently into the floor and lift your hips just 1 or 2 inches off the seat. Hold for 1 second, then slowly lower yourself back down over 2 to 3 seconds. That slow lowering is incredibly important. It's where the muscles get stronger. For many seniors, even this small movement is enough to wake up muscles that haven't been fully used in years. If you feel your thighs working, that's exactly what should happen. If you feel sharp pain in your knees or hips, that's a sign to reduce the height or slow the movement even more. Surgeons often recommend starting with just 5 repetitions. That's it. Not 20, not 30. 5 controlled repetitions. What? Or twice a day is enough in the beginning. After a week or 2, you can increase to 8 or 10 repetitions if it feels comfortable. More is not better here. Consistency is what creates results. Now let's compare this to walking again, because this is where people really start to understand why this exercise can be better. Walking is repetitive and low resistance. Your body adapts quickly, and after a while, walking no longer challenges the muscles enough to maintain strength. This chair movement, however, forces the muscles to push against your own body weight. That's real strength training, without weights and without risk. Another major advantage is joint protection. When you walk, especially on hard surfaces, each step sends a small impact through the knees, hips, and spine. Over time, this can worsen arthritis or joint inflammation. With the chair exercise, your joints stay aligned, supported, and controlled. There's no pounding, no twisting, and no sudden shifts. This is one reason orthopedic surgeons often prioritize this movement in rehabilitation programs. It strengthens the muscles that protect the knee joint. Strong thigh and glute muscles act like shock absorbers, reducing stress on the joints during everyday movements. There's also a powerful circulation benefit. As we age, blood tends to pool in the legs, especially if we sit a lot. This can cause swelling, heaviness, and even varicose veins. The rhythmic muscle contraction in this exercise acts like a pump, helping push blood upward. Many seniors notice their legs feel lighter and warmer after just a few repetitions. Now let's talk about breathing, because this is something almost everyone gets wrong. Never hold your breath during this exercise. As you press up, gently breathe out. As you lower yourself down, breathe in. This keeps blood pressure stable and helps oxygen reach the muscles. Surgeons emphasize this, especially for seniors with heart conditions or high blood pressure. One of the biggest mistakes people make is using their arms too much. If you push hard on the armrests, the legs don't get the full benefit. In the beginning, light support is okay for balance, but over time, try to rely more on your legs. Even resting your hands on your thighs instead of pushing can make a big difference. Another common mistake is rushing. Fast movements reduce muscle activation and increase joint stress. Slow and steady always wins here. Think of it as teaching your muscles to work together again. Many seniors ask, should I stop walking if I do this exercise? And surgeons are very clear on this. Walking is still good, but it should no longer be the only thing you do. Think of this chair exercise as the foundation. It builds the strength and stability that makes walking safer and more enjoyable. In fact, many people notice that after a few weeks of doing this exercise, their walking improves naturally. They walk taller. Their steps feel stronger. They get tired less quickly. That's because their muscles are finally doing their job. There's also a confidence boost that comes with this. Being able to rise from a chair with control is deeply connected to independence. When that movement becomes easier, fear decreases. And when fear decreases, people move more safely. Surgeons often say that the ability to stand up from a chair without struggle is one of the strongest predictors of long-term mobility. This one exercise directly trains that ability every single time you do it. In the final part, I'll explain how to safely progress this exercise, who should be careful or avoid it, and how surgeons suggest combining it with daily life movements for maximum long-term benefit. Now let's talk about how to progress this exercise safely, because this is where long-term results really take hold. Surgeons don't believe in complicated routines for seniors. They believe in small, smart progressions that the body can adapt to without stress. Once the basic partial lift feels easier, the next progression is simply increasing the height slightly. Instead of lifting 1 or 2 inches, you lift halfway to standing, then slowly sit back down. You're still in control the entire time, and the chair remains right behind you as a safety net. This increased range of motion activates the muscles even more deeply, especially the glutes, which are critical for balance and hip stability. Another safe progression is increasing the pause at the top. Lift gently, hold for 2 or 3 seconds, then lower slowly. This improves muscle endurance and joint control without adding any impact. Even 1 extra second can make a noticeable difference. Some seniors also benefit from changing chair height. Using a slightly lower chair increases resistance, while a higher chair reduces it. Surgeons often recommend starting with a higher chair if knee pain is present, then gradually lowering the height as strength improves. Now let's talk about who should be careful. If you've had recent surgery, severe knee or hip pain, or uncontrolled balance issues, it's important to keep the movement very small and supported. Always use a sturdy chair on a non-slip surface. If something doesn't feel right, stop. Mild muscle effort is normal. Sharp pain is not. For most seniors, though, this exercise is remarkably safe. That's why it's used in hospitals, rehabilitation centers, and physical therapy clinics around the world. It meets the 3 criteria surgeons care most about. It's functional, it's controlled, and it's repeatable. What makes this exercise even more powerful is how easily it fits into daily life. You can do it in the morning before breakfast, while watching television, or before going to bed. It doesn't feel like a workout. It feels like practicing movement. And that mindset matters. The body responds better when exercise feels natural and achievable. Many surgeons recommend pairing this exercise with everyday habits. For example, instead of dropping into a chair quickly, lower yourself slowly every time you sit down. That alone turns a daily activity into a strength exercise. Or, when getting up from a chair, pause briefly halfway up before standing fully. These small changes reinforce strength throughout the day. Over time, these movements retrain the body to move with control. That's what prevents falls, protects joints, and maintains independence. Walking doesn't train these transitions nearly as effectively. There's also a psychological benefit that often goes unnoticed. When seniors feel strong in their legs, fear decreases. Fear of falling is one of the biggest reasons people stop moving. This exercise gives a sense of control